A previously successful pregnancy does not guarantee that your next pregnancy will be smooth and successful. Now, things like your blood pressure, infection, anemia sometimes do not show any sign. That is why it is very important for you to take care of that unborn child early before anything. Today we'll be talking about the importance of antenatal care and why it is important that you register early and adhere to your antenatal schedule. Welcome to Health Unplugged, brought to you by Lifeway Medical Diagnostic Hub. Here we discuss, we dissect important health relating issues that matters to everyone. Today we'll be talking about the pregnant woman and how she can take care of her child very well through antenatal care. My name is Amazing Rita, and with me in the studio is Dr. Dimba Favor. Hi, Dr. Favor.
Hi, Rita.
It's always pleasant to see you.
I'm happy to see you too.
Okay, today we'll be advising pregnant women on how to take care of their unborn children through antenatal care. Now, there's a difference between registering and going for the antenatal.
Mm-hmm.
Some people register, they don't go. Some people register and go probably the day they've noticed that their child is not moving. And maybe they've spent like 2 or 3 hours pinching the stomach so that the child can move. And then they'll be like, oh, I registered somewhere. And they start rushing to the hospital.
Yeah.
So Dr. Favor, tell us, what is antenatal care and why is it important to register early?
Antenatal care is a planned, please take note of this word, planned, yes. It's a planned program for pregnant women that aims at monitoring, observing, educating, and informing the pregnant woman, yes, on things she should know and things she should be accustomed with in the course of her pregnancy. And then the whole aim of this is to ensure safe outcome of pregnancy for both mother and child. So it's a planned program. Actually, it's not like it's just maybe a patient just comes to the hospital, you start, it's actually a planned program.
Yeah, and you know the schedule and everything.
Exactly.
Okay, so how early should a pregnant woman register for antenatal?
They say as early as possible. Okay. As soon as a woman notices she is pregnant, she needs to register for antenatal. However, in like part of the schedule for antenatal, there's what we call traditional antenatal care.
Okay.
Yes. In this traditional antenatal care, the woman is expected to register as early as 8 weeks. Okay. Or if you don't want to use 8 weeks, you can say when she has second missed period.
Oh, okay.
Yes. As early as her second missed period or 8 weeks of pregnancy, she's expected to register for antenatal care. However, the woman can still go as early as when she discovers she is pregnant. And in this traditional antenatal care, there's a schedule. Okay. Yes. From that 8th week of pregnancy up till the 28th week, she's expected to come for antenatal care visits every 4 weeks.
4 weeks.
Yes. Then from the 28th week of the pregnancy up till the 32nd week, she's meant to go every 2 weeks. And then from the 32nd week till the 40th week, she's meant to go weekly.
Oh wow.
Yes. So this is what traditional antenatal care is made up of.
It's really planned. Okay. So why is it that doctors or healthcare practitioners, they always advise that you go for antenatal registration and begin your antenatal care when the pregnancy is still early? Because some women or some people will be like, since it's still small, there's no need doing so much. You just wait till maybe second trimester or third trimester. Then you know that the baby is strong and is ready for anything. So why do we emphasize on registering early?
The reason why early registration is important is because if there's any abnormality, they will pick it up immediately and pick it up early. Okay. Yes. There are some importance of antenatal care. One of it is targeted at identifying risk pregnancies, like pregnancies at risk, like they try to identify it early. Pregnancies that will have complications, they try to identify them early. And then when you identify them early, you're able to put in measures to help to avoid or manage these complications or risk. So this is why it's important to register for antenatal care early. Because imagine a situation where someone decides to register in the second trimester. By then, most organogenesis have occurred.
Yes.
So if there's any abnormality, they can't correct it by then. If this woman is a known hypertensive, if her blood pressure has been uncontrolled up to that moment, if it's possible she can lose that pregnancy even before the second trimester. So the essence of early registration is to help curb these things or manage them as early as possible.
Okay, so that means you're saying that early pregnancy can also help, like anything that they would see or anything that they notice.
Yes.
So is it everything that is being noticed that can be corrected during that early, noticing it while the baby is still in the womb?
Okay. If I got your question right, you're asking if it's every abnormality that is picked at that early stage that can be corrected. No, not all can be corrected, because some could be chromosomal abnormalities, and in situations like this you can't correct them. Yes. So in situations like this where you can't correct the abnormality, you know that when this child comes to the world, the child will have a lot of complications or issues. You counsel the mother and tell her this is the state of this pregnancy, and then you give her an option of either terminating the pregnancy or continuing with the pregnancy. So it's left to her. So for instance, you say pregnant woman, you do anomaly check, anomaly scan, and then you find out this baby, when the baby comes to the world, the baby will have a lot of complications, a lot of the child will stress both the parents, and he or herself will equally be stressed. So you have an option of counseling the woman on your findings, on the prognosis, on your line of management, and equally counseling her on terminating this pregnancy or continuing with it. Yes, so it's left to her. If, despite your counseling, she still decides to continue with the pregnancy, then it's her choice.
Okay, for first-time mothers, what would you say some of the things that that first antenatal visit would inform them about for first-time mothers?
First antenatal visit is we call it booking visits, and it's a very, very, very vital component or visit of antenatal care. In this booking visit, you're not just informing the patient, you yourself, you're also getting informed and getting aware of this patient's condition. You want to take history. In your history taking, you want to find out how many children she has had, how many times she has been pregnant. But for your question, you said a first-time pregnant woman. Yes, that is a primary gravida. That's what we refer to them. They're primary gravidas. You want to know if she has family history of twinning.
Okay.
Yes, because multiple gestation, that's twins, triplets, etc. Multiple gestations are sometimes classified as high risk, because the attention, the requirements for a single pregnancy will be different from the requirements of multiple pregnancies. That's twins and above. Yes, so you want to find out if there's family history of twinning. If there will be a possibility that this woman could be pregnant for twins, and then your line of management in some things would change. It will be different from that of a single pregnancy. Yes. Another thing you want to find out if this woman has family history of diabetes, hypertension, or if her herself has hypertension, diabetes, hyperthyroidism, any chronic disease, her line of management will equally change from someone who does not have any of these. You also want to find out if there are vital things you want to find out in this first trimester. You want to find out if she's a known HIV positive patient, if she's a known hepatitis B, hepatitis C patient, because her line of management will equally be different, especially during delivery.
Okay.
You also want to send these patients for, this one now is across board, not just for primary gravidas. you want to send them for some investigations, which they call booking investigations.
Yes.
In these booking investigations, you want to send them to do their PCV. PCV means their packed cell volume. You want to know their blood level. You want to send them to do hepatitis B, hepatitis C, HIV, and VDRL. Hepatitis B, C, and HIV will help you know the route of delivery to take.
Okay.
It will equally help you know how to, if the patient is positive, you have to start the child on post-exposure prophylaxis after delivery. So getting this information would help you on your line of management. Then the VDRL, you want to be sure this patient does not have syphilis, and if the patient has it, you want to plan the management of the patient. You also want to send this patient for an ultrasound, obstetric ultrasound, and this ultrasound will give you an idea of the location of the placenta, the location of the baby, how many children are in there. It also give you an estimated gestational age, estimated date of delivery. However, you on your own can calculate it with the patient's last menstrual period. So these are some vital components of that first booking visit. And then these are some things the mother herself will get to find out.
All right, so Dr. Vivo, in rare cases of some life-threatening pregnancies, like an ectopic pregnancy, how can an early antenatal care help in this case?
All right, early antenatal care is very important. And in cases like this, it will help you, first of all, to have an idea that this could be an ectopic pregnancy. However, ectopic pregnancy has its own symptoms that it presents with. Though the example we are using here, but it has its own symptoms the patient will present with. But early antenatal care will give you an idea, because, like I said, in the history taking, you want to find out some specific things. You want to find out if this patient has had bad obstetric history. Bad obstetric history, I mean, has she been having miscarriages or abortion, unplanned abortion or miscarriages, things like that. So it will give you an idea that this could be an ectopic pregnancy. And then the investigations, by the time she does the scan from the booking visit, the obstetric scan, it will show where the implantation is, where the fetus was implanted. So it can give you an idea, and it's important.
Okay. Now let's talk about supplements and vitamins. You know, as during antenatal visit, you're always advised to take your vitamins, your supplements, and everything. So tell us about that, how it helps, starting it early and getting the recommendation early, how it helps both the mother and the child.
All right, these routine drugs, we call them routine drugs, they are very important, and we keep emphasizing on the importance of all of them, especially folic acid. Folic acid should not even just be started in the pregnancy. Ideally, it is advised that someone who wants to conceive should start taking folic acid a month before conception. What folic acid does is, folic acid is just folate, vitamin B9. Yes, it helps in formation of the neural tube. You see some babies, when they are born, they have neural tube defects. Sometimes when you look at the back of their spine, you see an outshooting or something, a fluid-like substance around there. Some babies are born without head. All these things are neural tube defects. And all formation of this neurulation, this spine is usually formed between the first 28 days of life. So that's why it's advised 1 month before conception, the woman should start folic acid, because some people don't, in the first month of pregnancy, some people don't know they are pregnant, and by then they've already ignored folic acid. They didn't take, that's why it's advised to start taking it 1 month before taking in. Then the calcium gluconate is one of the routine drugs. That one will help in formation of the bones of the child. Calcium gluconate, calcium, just like it works in the adult body, one of the functions is to help in the build-up of the bones, the teeth. So this is also a function. Then we have the fesolate, because there's a particular quantity or amount of blood a pregnant woman should have. Yes, supplemental, there's what we call supplemental iron. Every pregnant woman should have. That's one of the things the folic acid would do for her. Then we have vitamin C for epithelialization, healing, etc. So these are examples of some routine drugs and their functions.
Okay. Now, for you talked about multiple pregnancies to be
Yeah.
like high risk pregnancy.
Yes.
Now, for women that are carrying multiple babies,
Okay.
and what are some of the things they need to have in mind that early registration of antenatal care would help them know?
Okay.
You know, some women, it could be their first time and they are giving birth to
Twins.
triplets.
Yeah.
You know, and there's always, you know, one thing people believe is that once you're hearing it from your doctor, it's solid information. So when they are pregnant with their multiple children and then they're hearing several things and the rest. So what are some of the information that antenatal care will help a woman with multiple gestation?
It would help the woman to know that, first of all, the intention is not to put fear into her, but the intention is for her to be very mindful, cautious, and careful.
Okay.
First of all, it will help to inform her that this is a high-risk pregnancy. High risk in the sense that it could end up in normal spontaneous vaginal delivery or CS due to one reason or the other. The nutritional requirements for her will not be the same with the nutritional requirements of someone carrying singleton pregnancy. Including the blood requirements will not be the same for her as someone carrying a singleton pregnancy. So birth preparedness, this person will need to be prepared in the sense that the cost of this delivery may not be the same as delivery for someone having a singleton pregnancy. So it means more money should be kept.
Okay.
Complication readiness, just in case there's any complication, you should be ready for it, both mentally, physically, financially. Exactly. So these are some things that antenatal care visit would inform this woman about.
Okay. What about how it helps to prevent birth defects? Like you scratched it a little. You said that if you notice like if through the early antenatal, you notice that the child is going to come out with particular birth defect, and then doctors can help manage it or they can help correct it. Walk us through it, please.
Okay, it's not like the doctors will manage it or correct it.
Okay.
Yes, let me correct that. Because like I said, some could be chromosomal abnormalities, some could be genetic abnormalities. These ones, the doctors can't actually change the chromosome or the genetics. So that one has, like, it is just fixed. They can't do anything about it. Then I think prevention would be a better term for it, yes, because there are some medications we consume that are not safe for pregnancy. That's why in the first trimester, even the doctors are very limited in prescribing medications for pregnant women. Like I said, this first trimester is majorly when organogenesis takes place. This is when organs of the body are being formed and what have you. So in this first trimester especially, you get to counsel the pregnant woman, telling her you shouldn't use so and so medications. There are some medications that contribute to these abnormalities. Yes, like some medications, when someone takes them, the child will come out without limbs, no legs. Some medications, when someone takes them, the child will come out with yellowish discoloration on the tooth, on the teeth. So these are some medications that one of the advantages of coming for antenatal is that you'll be counseled, don't take these medications. In fact, before you take a medication, see your healthcare provider. So this knowledge will help to prevent those birth defects from occurring. And then in the case of these ones that have affected the chromosomes or genes, exactly, they would be counseled, like I said, if they want to keep up with this pregnancy or if they want it terminated.
And then if they're to keep up with it, to maintain the pregnancy, the mother will be coached
Yes, you'll be aware of the findings. When I mean findings, you'll be aware of what the doctor has seen. When this child is giving birth to, these are the risks you stand to face as the mother of the child and as the father of the child. This is the financial implication as well. This is equally the prognosis, because some of those babies don't do well in life. Like their prognosis is usually bad. So you actually counsel the parents of the child on these findings.
So with all these benefits and everything you've told us, how antenatal care is beneficial to the mother, the child, and the family, why is it that some women will not still register for it? Instead, they will go to one mama and be receiving counseling on how to bend their baby, turn their baby, lift their baby. Why is it that some women still find it hard, difficult to go and register for antenatal care?
I feel it happens. It happens very well, and that's one of the things we're trying to eradicate from the society. We're trying to create awareness and make women know that it's very important to register for antenatal care. Some reasons why it happens: one, maybe ignorance.
Okay.
Some people are ignorant of the benefits of antenatal care. They just feel like, provided I'm pregnant, I don't have issues, okay, I just feel okay. Why do I need antenatal care? They're ignorant of the benefits of registering for antenatal care. They just feel it's only when there's a complication, maybe they are giving birth and there's an issue, they now decide to rush that child to the hospital. Another reason, lack of finance, poverty. Some people actually know they need to register for antenatal care, but they don't have the money. They're not capable financially to register for it. But that's, like I said, is one of the things we want to eradicate, because antenatal care actually is not expensive. It's one of the things that have been made very, very cheap and easily affordable by almost everybody. Too. Exactly. Another reason is accessibility. Some people stay very far and they're like, I don't even, which strength will I even use to take myself to this hospital that is as far as this? Because there are no hospitals located within them. In the olden days, in fact, it still happens now. People will be like, this child is a special child, maybe a child from the water and all of these things. So we are not supposed to register this child for any antenatal.
Give them injection or whatsoever.
Why some people, we've heard this one several. You see a patient coming to the hospital when there's already complication, and you ask this patient, why didn't you register for antenatal? The patient will be like, my husband was not around, so I needed to take permission from him to register for antenatal or to go for antenatal visits. And we're like, what does that mean? What do you mean by you had to take permission from him to register for antenatal for your well-being and the well-being of this child? So I think that one will be linked to ignorance and maybe financial instability, because the wife on her own, she does not have the money, and then she's now waiting for the husband to give her the go-ahead and to provide financial aid to go to register for antenatal. I feel these are some reasons why some people, despite knowing the benefits of antenatal care, they still don't register for antenatal care.
That's really serious. But beyond the labor room, beyond the delivery room, after the child has been given birth to, how can antenatal care, or the knowledge you've gotten from antenatal care, help you with handling your child?
All right. In antenatal care, one of the teachings, because they actually, when they come together, that's the pregnant women, they are actually people that lecture them and teach them on one or two things. Components of this teaching includes immunization, includes breastfeeding, includes how to take care of the umbilical cord. So these are some little knowledge they get to impact in the mothers, yes, when they come for antenatal. And then it helps them when they've delivered these babies. It helps them to take care of these babies. And remember, antenatal care is not just after the delivery, it extends to 6 weeks after delivery. Wow. So in the space of that 6 weeks, they get to learn more things on how to care for this child.
Okay, thank you very much. You know, the thing is that I feel when someone has the kind of exposure people have contributes to the knowledge they have and how they place them, how important, because if you place priority to your child, you want to do everything
to ensure that child
motherly
is fine.
possible to ensure that that child is fine. And if you're being told that this is the way, and this is not somebody trying to play on your ignorance or maybe make you gullible to any belief system or something, you know that okay, medically proven, this is what it should be. It's crazy, let me use that word, that you tell yourself that no, I will not do it. You know, and then some women, I've seen a case where a woman got pregnant and then lost the child and blames it on the hospital.
Why?
That it was this, she went for antenatal, she did this and everything. So when she got pregnant again, she decided to
not to go for antenatal
and went full herbal course. I'm telling you, it was a full course. Like she went full herbal, and when she got to the labor room, it was difficult because doctors were struggling or working with blindly, because all the knowledge the doctors would have gotten about her and her child,
gave them to the herbalist.
Gave them to the herbalist and said, hold it very well. And some of them, because of this ignorance, they even go and deliver in this place. And when the complication becomes so hectic,
that's when
they will chase them to the hospital.
For the doctors to do
if this person at the end of the day will chase you to the hospital, does he not tell you that going to the hospital
going to the hospital from
would
the
have been
outset?
the best? So please, lastly, before we go, what is one message you have for mothers, pregnant, first-time mothers, intending mothers, or mothers that are pregnant but still finding it difficult to, or they're not convinced to register for antenatal care?
One message I'll leave you then is this. Antenatal care is very important. Antenatal care guides the woman through the course of the pregnancy. And then antenatal care is not just for her own benefit. It's equally for the benefit of the husband, the child, the family at large, and the society at large. Because imagine if there's no antenatal care, many women will lose a lot of babies. And in fact, not just the babies, even their own lives will be at risk. Exactly. So antenatal care is very important. And then one basic thing is that government, even private hospitals, private facilities, they've made it very cheap. That even someone who feels like he or she is poor can afford it. They made it very, very cheap because maternal and child health is considered one of the very important aspects of medicine and health. Yes, so that's why it has been made very cheap and very affordable by everyone. So nothing should be anybody's excuse for not registering for antenatal care. Even if you've had bad experiences in the past, you can still give it a try. Or you can try another facility. Exactly. So that's it.
Yes, it is very important. If you feel you've had a bad experience, just go for another. I've not seen women who go on social media and ask, please, I'm pregnant, so what is the best hospital around this particular, and you see people advising like, you try these people. Yes, it's not good to try, but if you've had a bad experience, it's not a bad thing to try something else. Thank you so much for hanging around with us on Health Unplugged, brought to you by Life Medical Diagnostic Hub. We just talked about the importance of early registration of antenatal and how it can help not just the mother, the father, the child, the family, and the society, at large. So till we come your way again next time, do also like, comment, subscribe, drop your comments in the comment section, and we'll be happy to help you with whatever question you have. My name is Amazing Rita.
My name is Dimba Favor.
Until we see you again in our next episode.
Bye.
Bye.